Hi, this is Mia. This is Wednesday. I usually work. They had me off the schedule. It's 3:12. I would have been home anyways, and I am going crazy. This is probably the first time I just feel like the windows being up 5 feet tall. No windows on this side. A window there, or door there, sorry, and then a door downstairs that has windows on the side. Um, I feel like this is one of the times where the feeling like I'm in an underground bunker suffocating is happening right now, and I don't like it. My partner was home for 4 weeks, I don't know how many, more than a month, because the injuries from an auto accident, and I've been home for half a day, and I'm freaking heck out. I usually feel like I'm going to be happy inside the house and be able to clean, and there's like bugs in here and baby cockroach in the bathroom. There's some kind of vent in the bathroom. So all this junk here that I didn't unpack needs to be disposed of, or I don't care what. Something's got to give here. I got to rewash those clothes. I had a different vibe. In fact, with that different vibe, let's go in the other room. I had a different vibe when I was at the other apartment because there really was no room to move. But this, if I have hoarding tendencies, this could turn into that, but worse. It would be one whole apartment, one whole room filled up, and one whole room filled up this 3+1 bathroom apartment. That's what I'm trying to say. Filled it up. I mean, he bought these 2 pieces of furniture and brought back a table and some chairs, but everything else, that looks like it's bending down. We don't have a bed frame either. I think everything else, besides the stuff we bought before we moved, which was a bunch of plastic crates to put everything in, some sleeping bags, because I thought we were going to live outside, solar panel. So all the the solar camping stove, the other solar panel, black fabric to do the. Let me go get. Speaking of fabric, let me get something. I couldn't find my crochet project. I had my water bottle and stuff from the birth in there. So instead, I found I went to a class, neonatal resuscitation, and I got all this stuff. And I'm just gonna look at it here and now. This is a little sticky. I'm gonna put this on as a profile. Since some of this stuff like that. So it says on the outside, infant CPR bag, disposable manual resuscitation. Oh, and it has like a regular label, reference number, lot number, or it does have an expiration date, 4/28/26. Contains 1 infant resus bag, 1 infant mask, 1 neonatal mask, and 1 manometer for $70. They had these, I think, they have these or just the mask part for adults for $18. I should have bought it. So I did see CPR last night. I don't know why this little notch is here. Piece of hair. So my partner left because I had talked to him this morning about this class I was taking for caregivers, and I had asked him why he asked me why he said I was so close-minded, and I might be close-minded. I mean, everyone has the right to their opinion. I'm not necessarily thinking, my whole life, even my parents were strict and making fun of people and talking about people. I didn't like to talk about people, make fun of them, be mean because of who they are. I didn't have a habit of people that I knew were doing things that were stereotypical. They made their own stereotype. It's not like I read it or saw on the news that these type of people are like this. Just my friends happened to be very similar, and my mom's relatives. So it looks like just this is $70. That's super expensive. So it's a manometer, whatever. recess bag. I'm trying to figure out what. It's a large Ziploc bag. Okay, we're going to. I'm trying to figure out what the. Yeah, I need the adult one, Mercury Medical. I'm having problems getting medical supplies, so I'm buying from third parties. I'm trying to figure out why it seems to have two of these. I don't know where the oh, I guess this is the bag part. And then the meter. These things, I don't want to break it. Some of this stuff pops off. That shouldn't pop off. Mask. Oh, neonate. Infant mask and neonate mask. Okay, I get it. So this is the infant mask, and this is the neonate, so the baby mask. Alright, so let's put that back in here with all this stuff. I spent like $100 and something. So I have a large zipper bag. So if someone says something to me, I don't forget about it. So I paid $1 for this. It's kind of ridiculous, but the small bags are like between 26 cents for the sandwich. At least they used to be, to 50 cents for the gallons or something. But I don't think that's the Ziploc or the freezer one. That was a few years ago. I was trying to figure out like if you got 30 in a package and you paid like $4. What is it? But I guess it came in another bag, so I guess you might as well count that as part of the dollar. So that's the Mercury Medical, remember that. So this is mine. Oh, so I already had a CPR face shield for $10. I just bought another one. Oh no. Guys, this sucks. My boyfriend laughed because he couldn't stand being around me, and I am freaking out right now. Okay, so here's a CPR face shield, and now I guess apparently I have another one. This one was supposed to be $8, and that one, I don't want to take it out. Oh my god, is it in a Ziploc bag? That one, yeah, it's in a zipper bag. Alright, it's the tiniest little thing. I don't want to carry this to the concert this week, because they might confiscate it, saying, what the heck is it? And I was like, I just paid. So this, I guess you could put this on your belt. So it's a face shield with a pair of gloves. So I bought that from her. You can see that this is a waste of money for me. So these aren't even the kind of face shields that I was thinking. They used to have, remember the white ones that are like smaller? Yeah, this is not. Yeah, I used those in the class, so like, it'd give you like one, and if you accidentally like flipped it around, you're like, oh shoot, you're working with a partner. We're not even doing the blow in the mouth. I don't even know if we did it. We're never doing the blow in the mouth. And most of the time, you're not going to have one of these on you, just going to the grocery store or whatever. I mean, my boyfriend wanted to buy one last year. And then there's a pair of gloves in there, so that's pretty much. These things could be like $2.50. It's pretty much a ripoff. But good to know that I have two of these. I'm going to keep it in there for now, because I know I have one in my purse with the sticker. I can't believe I did that. I thought it was going to be the white one. It's kind of like that plastic fabric. Alright, so this is my bag. These are the old bags from, we used to get the gloves in these zipper bags. And people are like, oh, you can use those to put tools or nails and stuff in. So I was saving, I had like a lot of these. A lot of these got thrown away or recycled. The alcohol prep, I don't know if it's any good. It says it expires 5/2014. That's really old. Like, these gloves, don't use them if someone has like a pen mark on it. So I have a pair of gloves that are old. alcohol swab. I'll go in the bathroom. I have some more alcohol swabs. And then I have, oh shoot, this is full of air. That means it's rotten. This is a Giovanni wipe. It's like literally full of air. So I'm gonna take this stuff out of there, and I'm gonna replace it. Let's see. My daughter gave us this for Christmas. So I'm gonna replace it with, oops, whatever this is. Let's see if there's an alcohol wipe. So it's mainly Band-Aids and medicine. This is really nice, and there's big Band-Aids. It's really, really nice. There's cloth, 2 different sizes, lots of different styles, and I've got some waterproof. I actually need one for my finger. I'll wait till I go out. Unless I'm doing something else. Let's try out. Yeah, there's a few waterproof ones. We'll like to reorder this. There's this ibuprofen, triple antibiotic, hydrocortisone cream, steroid cream, unicorns. Keep using the unicorn thing. Oh no, that's not going to be anymore. So there's the cleansing wipe. Let's just put that in there. You know what? Let's go ahead and do one of those. There's not many of these, so I'm just going to keep those in there. There's not many of the other wipes. I'll just put there's a really small Band-Aid. I'll put one of these Band-Aids, a waterproof Band-Aid in there. I'll dump this out. I'll actually put the gloves in there. They're not sterile. I'll take the alcohol out because I feel like it's cool. It's probably used. This white could be rotten. These are expensive. Like, I'm complaining about one thing. These are like $2.50. Think about wiping down or something. So I'll just replace it. I'll come back and try to remember to put another alcohol wipe in there. And then it came with tape. And I don't think there's anything underneath. I didn't try it. It says antiseptic triple something. Small bandage, butterfly strips. The butterfly strips are good. Let's put one of those in there. It's like regular clear tape, hydrocortisone, triple antibiotic. I gotta put triple antibiotic in there. But, so there's not that much. I have, what do you call it? I'm thinking of a word. I does not seem like the way that it was. I gotta get back on this class. This is to check in. So I'm home by myself. I have this generic. It was hard to get stuff last year during COVID, and we had the Rite Aid or Walgreens. It's the only 2 from this whole wall. So there's like Band-Aids and those. They had the white gloves and all these different things. Right, so I got the manometer, which is that dial. So that would just go on. I just got it in Russian. So keep that in mind. This place. I took this Ortofon, so I don't want to spend any more money. It's a diagnostic test. I don't know what that means. Healing package. Care of the print. Training on holistic midwifery. 1 pregnancy, $80. 2 labor and birth, $130. Pelvic anatomy desktop software, $45. Private use license. If you want more permission for software, go ahead and pay this amount and I can invoice you for additional permissions later. Special NRP discount minus $5. Free immediate shipping mail to any USA address. Just out of Portland. Oh wow, midwiferybooks@gmail.com. Midwiferybooks.com. That's a good website to have. So this is coming out of Portland. I wonder who that is. That's where I did a whole bunch of births. Just get started in my life. And I said I'm young. I didn't mean to say that. I didn't mean to say that. Alright. Oh, is this some... This is the bag. This is why I'm pulling this out. I wanted to share with you guys. I thought something was missing. I'm gonna take this off. So this will have to be cleaned. Oh, it's got a dent in it. You don't want to. You just want to do the little ones. The adult ones, same thing. You don't want to do too much, and you don't want to cover the top off. You don't want like if okay. So it's like, and so that would be clean before birth. In the hospital, they probably throw that away. There's like just tape on it. That's crazy. 6,000. And this is a bag, and then I don't have an oxygen tank. My partner does. But, so you have that, the oxygen. Next time I'm with the midwives, and they already have all their stuff, go ahead and look. And it had medical oxygen. It's both like a little tiny oxygen tank. What, $60 or something? 2 years ago, I could have bought it. I mean, what would I have done with that? And then I have the CD that I'm going to watch. I think, is it a CD? Circumcision. I can't believe I got a circumcision. It's good to know. So I was asking my partner about that. We'll leave that here because this was in the car. We'll watch this. I don't work Friday. I watch it Friday morning. I work tomorrow and I don't need him to watch it. So it's graphic. Resuscitate Cradle. Thank you for attending my class. Take $5 off your order by using this code. Laryngeal mask airway. So she wrote something. So this was $40. So I spent all this money to save somebody's life. I forgot I had this. I'm not going to take it out. It should be sterile. RX only. So RX, I'm a doctor. I guess if you're at a birth, do you just prescribe it? Have the midwife prescribe it? We used in Portland they had the metal laryngoscopes. Is that what it's called? Laryngeal mask area LMA. Anyways, they had the metal ones where you can stick the tube in for the epinephrine. I'm trying to think. We had dolls that we used because it's like when you had a light shining in there. Anyways, I feel like I had to do it right-handed. So the plastic ones will go down in the baby's throat, and this is only one side, so this plastic would come off, and that blue part would go in the throat, and then this tube has got the same type of opening as for the oxygen. And so the metal one, I don't have one. So midwives in Oregon, I know have them. There's a lot of stuff in those bags that is, there could be gauze, there could be suture, I don't know. If you're at a long birth and if you're in front of the patient, you don't necessarily want to be going through the midwife's bags, especially if they don't give you permission, because it sounds like a tense place. But if you work with someone, like one of our teachers, we had to go out to her car, her SUV, she took everything out of the car, and went ahead and did an oxygen tank. Issued an SUV, she pulled everything out in her bags and put it on like a platform. It's like, this is what I have for my birth. some people have an IV bag carrier, like the metal post that usually we take a hanger and it might put a hole in their ceiling or something, hang it from there, or put it on a broom and duct tape it and have them walk around outside like that. So this is good because this is the stuff that she taught us for the class, which so Mr. Sopa, that would be the neonatal resuscitation program, so the NRP. So this is a size 1 LMA for newborns less than 5 kilograms. And then there would be a preemie size 1. Always do a total of 30 seconds of PPV once air is going in. Mr. Sopa, mask adjustment, reposition airway, try again, suction mouth and nose, open mouth, try again, pressure increase, then alternative airways. I don't have a bulb in mask. I'm still technically a student, so you can call this soft tissue damage. Completion does not imply competence. That's probably a really good statement. I had people in my school that like cheated, and they tried to tell me I was stupid and all this stuff, and I'd study and I'd get good grades, and I still thought I was stupid because everyone told me I was in that school. And then I worked on projects in the class. No one would be my partner, and I worked on stuff by myself. It's like 6th grade. Like, let's not work with her today. And I was like, I need a group, and nobody's paying attention. And I did it all by myself, and I got it all right. And that was biochemistry, and I was like surprised. And then I remember taking tests and getting a lower grade, and it'd be concerning. Like say I got like an 80 or 78 or a 85, and everyone else is like, oh, I got 95 plus. And everyone was like, oh, we all emailed each other the answers to the test. The test was the same as the years past. Didn't you get the email? We didn't study. We just memorized the answers. No, I didn't get any email. I don't want to get an email. But could you imagine the teacher saying, oh, I taught this class and I did a good job, and most of the students but Mia got 95 plus. And I studied and read the book and the notes, went to every class, took notes, paid attention, and took the test with my own brain. Passed the test, but I think in one of those classes, actually, I think I borderline. I think they wanted you to have a higher grade. Like, I think some of them, they like, you're supposed to have like 70 to pass, or 75 or 76. Sometimes they'll raise it up to 76 to 80 on cumulative of all your exams. So you don't want to have a bad sick day and get a 72. If you're supposed to get an 80, you're going to fail. Unless you get like 90s and all the rest. So I think I was that the same class? I was like borderline, so I had to ace the final. But yeah, people are like, didn't you get, everyone else got the email of the answers to the test from the previous years. And I was like, I don't even want that, first of all, but just imagine how often that was happening. Like, it's one thing to have study guides. They would keep those to themselves, but study guides and practice tests, practice questions. I'd use, what's the flashcard program? I can't remember what it's called, but it can generate tests, and not necessarily always true and false. Like, what is the chemical formula for water? True or false? Like, sometimes they don't match up. My partner might be coming back. I'm gonna get like, oh yeah. I spent $5 on saran wrap to wrap a baby up. So that was my grand finale. If it's 100 square feet, it's a waste of money. But I said, you know what? I hate this about myself. If it saves somebody's life, I'll do it. Saran. And she has a sticker and everything on everything. Here's something definitely. $470, so 100 square feet. So she would have probably got it cheaper because everything costs more now. That's at Walmart. So I think I looked this up before. It was about the same price. So I felt like it was going to be about the same price, with the likelihood that I would not go to the store and buy it if I could even find it. Stuff's just getting hard to find. And this is the sticky one, I believe. So you have a issue with a baby, you ought to use this plastic bag. Besides a blanket, plastic bag and plastic, you can see the skin color and breathing the rest of the months. Raising. I'm going to go back to my HIV Continuum of Care course. It's coming out of Portland, Oregon. Peace.